Visual snow syndrome. Most people assume that if something was seriously wrong with their body, a doctor would have caught it by now. That assumption is doing a lot of damage. Visual snow syndrome is a neurological condition where people see constant static across their entire visual field, like an old TV with bad reception, but permanently over everything, all the time. It often comes with after images, trails behind moving objects, and difficulty seeing in the dark. Here's the thing. Most people who have it have never reported it because they assumed everyone sees this way. They've never known anything different. The condition was only formally recognized in medical literature in 2014. Before that, patients were routinely dismissed, decades of people describing their vision accurately and being told it was anxiety. The condition was real the whole time. The medicine just hadn't caught up. ADHD. Most people picture a hyperactive kid who can't sit still. That's one presentation. It's not the most common one in adults, and it's the reason so many people spend decades undiagnosed. Adult ADHD looks like chronic disorganization, inability to sustain attention on things that don't immediately engage you, impulsivity, emotional dysregulation, and a baffling ability to hyperfocus intensely on interesting things while being completely unable to start anything you don't find interesting. It gets misread as laziness or poor character for years. Here's the messed up part. The average age of ADHD diagnosis in adults is the mid-30s. That's 30 plus years of struggling with a neurological difference, being told to try harder, building an entire identity around being the person who can't get it together. The condition was there the whole time. Nobody looked. Bruxism. You might be grinding your teeth every night and have absolutely no idea. Bruxism is involuntary teeth grinding or jaw clenching, and the majority of cases happen during sleep. You are unconscious, you don't feel it. The signs show up elsewhere. Worn enamel, jaw soreness in the morning, frequent headaches, a partner who mentions the noise. That's the trap. People treat the headaches with painkillers and the jaw soreness with nothing because they never connect the two. The grinding continues. The enamel keeps wearing down, and when a dentist finally mentions it, the patient is usually shocked. Teeth don't grow back. Whatever got worn away while you were unaware of it is permanently gone. TMJ Disorder. The temporomandibular joint connects your jaw to your skull. When it malfunctions, the symptom list is strange enough that almost nobody connects it to their jaw. TMJ disorder causes jaw pain, clicking when you open your mouth, headaches, ear pain, ringing in the ears, neck stiffness, and facial aching. That's a symptom profile pointing in 6 different directions. Most people end up at an ENT for the ear symptoms or a neurologist for the headaches and never get a useful answer. Here's the thing, TMJ disorder is frequently made worse by stress-related clenching, which means the people most likely to have it are also the people most likely to be told their symptoms are just anxiety. A jaw problem being explained away as a stress problem, indefinitely while the jaw gets worse. Migraine with aura. A migraine is not a bad headache, and a migraine with aura is a specific neurological event that enormous numbers of people experience without knowing it has a name. The aura comes before the headache. Zigzag lines, blind spots, flashing lights, temporary numbness, sometimes difficulty speaking. It lasts 20 minutes to an hour. Some people get the aura with no headache at all, which makes it even harder to identify. Here's the messed up part. Migraine with aura carries a significantly elevated stroke risk in certain populations, particularly women who smoke and use hormonal contraception. It is not just a headache with a light show. It is a cardiovascular risk factor. Most people who have it don't know that. Most of them aren't even sure what they're experiencing is a migraine. POTS. Postural orthostatic tachycardia syndrome. The symptoms are things most people have spent years explaining away as just being like that. When someone with POTS stands up, their heart rate spikes abnormally, often by 30 beats per minute or more within 10 minutes. The result is dizziness, brain fog, fatigue, heart palpitations, and sometimes fainting, all triggered by simply being upright. The average time to diagnosis is 5 to 7 years. People spend years being told they're dehydrated, anxious, or out of shape. The condition is real, measurable, and diagnosable with a tilt table test. The reason it takes that long is that the symptoms are common enough to be explained away by anyone who doesn't think to look further. You've probably described at least one of these symptoms to a doctor. You probably got told to drink more water. Prediabetes. Prediabetes has no symptoms. That is the entire problem. Your blood sugar is elevated, doing quiet damage, heading toward type 2 diabetes, and you feel completely normal. Nothing prompts you to check. The American Diabetes Association estimates more than 80% of people with prediabetes are unaware they have it. Here's the thing. Prediabetes is reversible. Lifestyle changes at this stage can bring blood sugar back to normal and prevent type 2 diabetes entirely. The window closes. The longer the blood sugar runs elevated, the harder the reversal becomes. The condition is caught late not because it's difficult to detect, but because nobody tested for it while there was still time to do something meaningful about it. One blood test. That's the distance between catching it and missing it. GERD. GERD is not just heartburn. Heartburn is one symptom. The rest of the list is what people miss entirely. GERD causes chronic cough with no respiratory explanation, persistent sore throat, the feeling of something stuck in your throat, hoarseness, disrupted sleep, and dental erosion from stomach acid reaching the mouth at night. Most people experiencing these symptoms are not thinking about their stomach at all. That's the trap. They treat the cough, they treat the throat, they treat the teeth, separately, indefinitely, without ever connecting them to the same source. Long-term unmanaged acid reflux also causes structural changes to the esophagus. The thing most people treat as an occasional inconvenience has a significantly worse version waiting at the end of years of ignoring it. IBS. IBS affects roughly 10 to 15% of the global population. The majority of cases are undiagnosed. The primary reason is that people don't report symptoms involving their bowel habits because it's not a conversation most people want to have voluntarily. IBS causes abdominal pain, bloating, cramping, and unpredictable bowel patterns. It's triggered by food, stress, and hormonal changes. It significantly affects daily life in ways people silently absorb for years. Here's the thing. People organize their entire lives around managing something they've never had a name for. Avoiding certain foods, planning around bathroom access, managing anxiety about flare-ups. Most of them assume this is just how their stomach works. It's not. It's a diagnosable, treatable condition they never asked about because the subject felt too awkward to raise. Iron-Deficiency Anaemia. The symptoms of iron-deficiency anemia are so generic that most people never connect them to anything specific. Fatigue, weakness, difficulty concentrating, feeling cold when others don't, headaches, shortness of breath doing things that shouldn't wind you. Iron is what hemoglobin uses to carry oxygen through the blood. When iron is low, oxygen delivery to every tissue and organ drops. Your brain gets less, your muscles get less. Everything that requires energy gets harder and slower, and you have no idea why. Here's the messed up part. Iron-deficiency anemia is the most common nutritional deficiency in the world. It is diagnosed with a basic blood test. Enormous numbers of people are walking around with measurably insufficient oxygen delivery to every cell in their body, attributing it to stress or poor sleep, or just not being a morning person. One blood test, that's it. Vitamin B12 deficiency. B12 deficiency develops slowly. That's why it goes unnoticed for so long. By the time the symptoms are obvious, it's usually been building for months or years. Low B12 causes fatigue, numbness, or tingling in the hands and feet, difficulty with balance, cognitive slowing, depression, and memory problems. The neurological symptoms are the concerning ones. Prolonged B12 deficiency causes nerve damage. Some of that damage becomes permanent if left long enough. Here's the trap. The symptoms get attributed to aging, stress, or depression, and the actual cause keeps running untouched underneath. B12 deficiency is particularly common in people who eat little animal product, people over 50, and people on certain common medications including metformin. Doctors frequently don't test for it unless prompted. The fix is a supplement. The cost of not finding it is nerve damage that doesn't fully reverse. Hypothyroidism. The thyroid regulates your metabolism, energy, body temperature, heart rate, and mood. When it underproduces, everything slows down. And it does it gradually enough that most people don't notice until they look back at who they were 2 years ago and can't account for the difference. Hypothyroidism causes fatigue, weight gain that resists effort, feeling cold constantly, dry skin, hair loss, brain fog, and depression. It affects roughly 5% of people over 12 and is significantly more common in women. Most people with it describe feeling like a dimmer version of themselves without being able to say exactly when that started. That's the trap. Every symptom has an alternative explanation. The weight is diet. The fatigue is stress. The low mood is circumstantial. The thyroid never gets considered because each symptom in isolation points somewhere else. It takes one blood test to check. Most people with undiagnosed hypothyroidism have spent years treating each symptom individually, while the actual cause sits there, testable and fixable, completely untouched. Generalized anxiety disorder. Most people think anxiety is just worrying a lot. That's not GAD. GAD is persistent, excessive worry about multiple areas of life, present most days, difficult to control even when you know it's disproportionate, for at least 6 months. The physical symptoms are what go unrecognized. Muscle tension, fatigue, difficulty concentrating, irritability, sleep disruption, headaches. People treat each one separately and never identify that they're all downstream of the same thing. Here's the thing. GAD affects roughly 3% of the population, but is thought to be significantly underdiagnosed because the worry feels like a personality trait rather than a symptom. People who have it usually say they've been this way their whole life, which is true, and also means they've spent their whole life with an untreated condition they thought was just them. Those are not the same thing. The difference is that one of them responds to treatment. Lactose intolerance. Lactose intolerance affects roughly 68% of the global population. The majority of humans on Earth lose the ability to fully digest lactose after early childhood. The people who retain that ability into adulthood are the statistical anomaly. The symptoms are bloating, gas, cramping, and diarrhea after dairy. Mild cases produce mild symptoms, easy to attribute to a bad meal or just how your stomach is. Here's the messed up part. People spend years informally avoiding dairy because they've noticed it makes them feel bad, without ever connecting it to lactose, without ever knowing there's a name for it or a straightforward management strategy. The condition is common enough to be called a default human trait, and yet most people who have it find out by accident if they find out at all. Hypertension. High blood pressure is called the silent killer. Not as dramatic language, because it has no symptoms and causes fatal events. Hypertension damages arterial walls, strains the heart, increases stroke risk, causes kidney damage, and contributes to heart attack. All without producing any sensation you would notice. You feel completely fine. The damage accumulates anyway. The World Health Organization estimates roughly 46% of adults with hypertension are unaware they have it. Nearly half. It's diagnosed with a blood pressure cuff, available in most pharmacies for under $50. The barrier is not access or cost. It's the absence of any symptom that would prompt someone to check. Everything feels normal right up until it doesn't. And when it stops feeling normal, the damage has usually been running for years.